Ladies and gentlemen, I am pleased to address the critical issue of sex work and health. Sex workers are key contributors to addressing public health challenges and demonstrated by lessons from the HIV, AIDS, and COVID-19 pandemics. Yet, they face diverse challenges, including the risk of HIV and STIs, along with other issues like social exclusion, criminalization, and mental health concerns. The criminalization of sex work leads to various struggles, including health problems, social stigma, discrimination, mistreatment by law enforcement, physical violence, and fear of arrest or prosecution. Despite criticism from organizations like the UN, WHO, UNAIDS, and others, the criminalization of sex work is still happening worldwide. According to the European AIDS Treatment Group, sex workers, mainly due to criminalization of sex work, are more vulnerable to HIV. A study published by Lancet found that sex workers are almost 4 times more likely to be infected with HIV compared to the general population, emphasizing the urgent need for specific actions. The vulnerability to diseases among sex workers is more pronounced in countries where sex work is illegal. The World Health Organization reports that any kind of criminalization limits access to healthcare services. It is important to abolish the stigma around sex work. Thus, the legislation that is causing the stigma. Modeling studies shows that decriminalizing sex work could lead to a significant 46% reduction in HIV infections among sex workers over a decade. A frequently ignored aspect of the challenges sex workers encounter is mental health. Challenges like stigma, discrimination, and criminalization contribute to intensified levels of anxiety, depression, and post-traumatic stress disorder. Other intersectional issues, like limited access to housing and poverty, make it more difficult for sex workers to maintain good health and access the health care, including mental health care that they need. The evidence is clear. Criminalization slows down access to health care and increases vulnerability to diseases. It perpetuates a cycle of poverty and mental health struggles. Decriminalization of sex work is a strategic move for the European Union to break the cycle of poor health outcomes. Sex workers are essential actors in shaping effective responses to health crises. Recognizing this, Member States and the European Union must actively involve sex workers' organizations in discussion and policy-making processes. It is time for the EU to lead by example and defend the rights, health, and dignity of sex workers. Thank you.